Getting a mastectomy is a very scary and very foreign procedure for many women. Even if you've had another surgery, this surgery is different. But here's the good news. There are tips and tricks that can make your surgery recovery so much more manageable. Less pain during your recovery, less frustration because you know what to expect, and be able to get back to your life so much sooner. Here are 12 things that you need to know about a mastectomy, but no one's probably told you. In this video, I'm letting you in on those tips that nobody is talking about. Starting with tip number 1, you have surgery options. Keep in mind that you're in the driver's seat and you have surgery options. There are options for reconstructive surgery like deep flap or implants, or you can opt to have no reconstructive surgery at all and just go flat. The FDA states that women with breast implants that have a textured surface are at a very low risk, but a risk nonetheless, of developing anaplastic large cell lymphoma. The treatment for this type of cancer is removal of the breast implant along with the cancer, as well as chemotherapy and radiation in some cases. The actual risk of developing anaplastic large cell lymphoma is very low. 1 in 30,000 women with textured implants may be at a risk of developing this type of cancer. When we look at the big picture, breast implants are actually really safe. But this low risk might still be too much for some women. Most women who are undergoing a mastectomy are doing so because they've been diagnosed with breast cancer. The idea of having a reconstructive surgery option that would then in turn increase your risk of a different type of cancer, well, that's just too much for some women, so they don't want to go with that option. Of course, if implants are a good choice for you, then that's great. Just know that there are other surgery options for you, like the deep flap or just flat closure. The deep flap surgery is when fat is cut from your lower belly and actually moved to your breast area to rebuild the breast. You're essentially using your own fat on your body to recreate your breast. This is a rather specialized surgery, so not all hospitals or all surgeons will be able to offer this. The recovery time with this type of surgery is also a little bit longer because you do have that incision in your abdomen. So it's going to take a little longer to recover when we compare it to implants or just flat closure. But flat closure or just going flat, that's also an option to consider. There is becoming a lot more acceptance around just going flat. Many women do say that they do feel pressured by their healthcare team to undergo some type of reconstructive surgery. There is a misconception that women may feel self-conscious or incomplete if they don't have some type of reconstructive surgery. Every breast cancer thriver is completely different, so you need to consider your options specific to you. There are many women who feel very confident and comfortable with flat closure, but there are other women who are very happy with implants. Whatever your choice, it's valid. Do your research and know that if you are uncomfortable, keep pressing for other options. You have choices. Next up is tip number 2, and this is actually good news about your mastectomy. I know, there can be something that no one will tell you that is actually good news. Your incision will not be bloody, gory, and gross. When you remove your bandages after surgery, your incision is not going to be bloody and gross. Surgeons take a lot of pride in making sure that their incisions are clean, tidy, and precise. Many women think it's going to be a gory scene after a mastectomy, but it's just not true. For the most part, many women might feel a little unsettled by looking at the transformation in the body, or they might feel like their incision actually makes them feel kind of uncomfortable or squeamish, but it's not going to be bloody and gross. Now, along with the incision from your mastectomy also comes drains that are required as part of your surgery. Let's get into more about these drains and what they don't tell you about these JP drains specifically. JP drains are in place for up to 2 weeks and are a necessary part of mastectomy surgery. The drains are located on both sides and actually collect fluid as part of the healing process. The fluid is called seroma fluid and is actually created as part of the healing or inflammatory process. But here's why it is so important to remove this fluid. Removing the fluid helps with healing and removes the pressure off of the incision. We want to avoid collection of fluid under the skin and allow that incision to heal properly. Okay, but here's the really surprising thing about these drains, and more specifically, the fluid that comes out of these drains. It's normal for the fluid that comes from these drains to change color over time. The fluid is collected in small bottles, and as your body heals, the color of that fluid will change as well. First, the fluid will be a bloody color, then it will change to a slight pinkish color, and then eventually to a pale yellow. This change is happening as your body heals. Different cells are involved in the healing process, and as such, that fluid color is going to change over time. This is actually really linked to the most surprising part of a mastectomy, which I actually touch on at the end of this video, so keep watching until then. Tip number 5 about your mastectomy is a really important tip about driving home after your hospital stay. After the surgery, you're obviously going to be experiencing a bit of pain. But what most women don't think about is their actual drive home from the hospital after their surgery. When driving home, every bump and pothole is gonna cause a little bit of pain. With these movements or bumps, it's gonna cause pain when normally you wouldn't have even noticed this at all. Of course, whoever's driving you home is gonna be completely unaware that it is actually causing you pain because it's not bothering them at all. So here's what to do to prevent this painful trip. First, change your route and pick a road that's really smooth. For me, the main street that leads back to my house is full of bumps and dips and is really unpleasant to drive on after surgery or after chemo. Normally, when I'm driving home, it doesn't bother me at all. But when you're in pain or feeling unwell from chemo, this is a big deal. So instead of taking this main route home, my husband would take a secondary road that was way smoother. It might take a little longer to get home, but it's a much more pleasant drive. This was such a better option for me after surgery. If we were to take the main road home, it would lead to bumps and potholes, and I would quickly have to say something to my husband who would otherwise be completely unaware. The second thing you can do on the drive home to minimize the pain is so simple, but hardly anyone will tell you this. Soft pressure on your chest can make a big difference. Bring a pillow along, or even if you can bunch up a coat or a blanket and hold that on your chest, because that will help minimize the pain. It's these simple but really practical tips that can make a huge difference in your mastectomy recovery. I'm so happy to be able to share these practical tips with you. Not only my practical tips as a cancer survivor, but pairing that with my knowledge as a doctorate in cancer care. Once you get home from the hospital, you'll want to make sure that you're comfortable and able to rest. And that actually brings me to my next tip, which is sleeping after a mastectomy can be really tough. You might not realize that you're not going to be able to sleep on your stomach or even your side for a really long time. For women who sleep on their stomach or their side, it can cause a lot of stress and anxiety around how are you going to sleep? But most women adapt to this quite quickly. Your body's gonna need to rest and heal, so you'll adapt to the sleeping process quickly in order to allow your body to do that. Now, naturally, you won't be able to sleep on your stomach because of the incisions, but you're also not gonna be able to sleep on your side because of the drains. That leads you to just sleep on your back, but just laying flat on a bed is actually not an option either. You'll need to sleep on your back, but in an inclined position. Recliner, elevated bed, or using pillows. Try any of these options and find the one that allows you to get the most restful sleep. Now, there is something that I need to share with you post-mastectomy that I'm sure no one has told you. Your armpits, they're gonna smell weird. Most of your time is gonna be spent with your arms down straight by your side. Because of this, there's really not gonna be much room for air movement in your armpits. As a result, there can be a really stinky, almost like cheese smell from your armpits. I bet you no one mentioned that to you. Obviously, this is stinky, but not harmful. But if it does bother you, well, here's what you can do about it. Try to just gently clean the area. Even if you can lift your arm just slightly away from your body rather than up, then you can get a flattened washcloth in there to clean the area. A breast cancer thriver that I work with in the Cancer Freedom Program had a mastectomy that went straight to implants, and she found that the smell of her armpits was almost unbearable. She compared it to the smell of blue cheese, and she hates blue cheese. In the first few days post-op, she would use a flat washcloth and slide it between her body and her arm to wash the area. And then when she got further out from surgery, she tried using spray deodorant because that way it put no pressure on her armpit at all. Which actually leads me to my next point. A mastectomy is most often more than just one surgery. When working with breast cancer thriver clients, it's often a very common misconception that a mastectomy is just one surgery, one and done. But that is simply not true. If you select a mastectomy and then implants, you're likely gonna have one surgery for the mastectomy, one to put in the implants, and then likely a third surgery to do any revisions that you may want. For some women, this can even continue into multiple revision surgeries. Just keep in mind that depending on the surgery option that you choose, you may be having more than one surgery. That brings me to my next very important point. This is something that breast cancer thrivers are really concerned about surrounding a mastectomy, and I'm betting that you care a lot about this too. Most women are really concerned about being in pain after surgery, and that is completely warranted. Because of this possible pain that you'll be in, you're likely going to be prescribed various painkillers. During surgery, many women are given an injectable painkiller right into the incision that will give you pain relief for about 48 hours. After that, you're likely going to be prescribed various painkillers that will give you relief for the next several days. But here's what you need to know about painkillers. If you don't stay on top of this, it's going to cause you a lot more pain later on. Painkillers are very constipating. If you've ever struggled with constipation, then you know that this can really impact your life. This is a really important issue, but even more so when you're recovering from surgery. Really, the two should always go together. If you're prescribed a painkiller, then you need to be prescribed something for the constipation. This could be over-the-counter drugs like Restoralax or Senecot, just something that's going to help prevent the constipation that these painkillers can cause. This can sound so trivial, right? Like constipation, this is not a big deal. But if you don't take this advice now, you're gonna regret it later. Which actually reminds me of one more thing that you need to know about your drains. Speaking of being uncomfortable, we need to talk about how you're gonna feel when those JP drains are removed. Getting your drains removed can be uncomfortable. The day you get your drains removed is a day that many thrivers look forward to. Of course, these drains are annoying and uncomfortable, but some women find that the drain removal can be also uncomfortable and maybe even a little bit painful. Just prepare yourself that it may not be the smoothest transition. Many women also wonder about when they'll be able to return to work after a mastectomy. This obviously needs to be individualized to you, your body, and your job, but we do have some rough guidelines about how long this will take. Now, if you have a desk job that has little to no physical activity involved, then you could be cleared to return to work in as early as 2 weeks. But if you need more time to heal, or if you have a job that requires you to walk or do some light lifting, overhead even, then this can take up to 6 weeks before you're cleared to return to work. And that leads me to my 12th tip. The 12th thing that no one will tell you about a mastectomy. This one is huge and really impactful to the rest of your life. Number 12 is all about tips on how to minimize your scarring. There are 3 key things that you need to know about how to make your scars look the best they possibly can. All of these strategies can be used once your incision heals a little bit. So be sure to touch base with your team to make sure that you're all good to dive in. First, you need to keep the area moist. Apply lotions or oils. There is some literature to support that vitamin E will actually help with the healing process and minimize the appearance of scars. But you do need to apply lotion or oil several times a day and make sure to just keep that area moist. The second thing that you can do to minimize the appearance of your scars is scar massage. This is a big one. If you're gonna take anything away from this video, let it be this. After an extensive abdominal surgery, I have a scar that runs the full length of my torso. Obviously, this level of scarring can impact you physically from all the scar tissue, and the appearance can also be very extensive. But I use scar massage twice a day for 20 minutes each time. Massaging in all directions, all around the scar and on top of the scar, that makes the world of difference. My scar is barely there anymore. You can barely see it. The scar tissue is so minimal, it does not impact my day-to-day or when I go to the gym. Now, the last thing you can do to minimize the appearance of scars is to use silicone strips. Silicone gel is also available, but a silicone strip allows for more contact time on the area. You could wear this on the scar overnight, so it has more contact time for that 8-hour period and allows for better healing. In the long term, silicone strips have been shown to reduce redness and thickness of the scar. They're definitely worth the investment, and I've actually put an Amazon link right below to a product that I suggest to make sure that you get high quality medical ingredients and something that's designed for after a mastectomy. But Here's the truth. If you're a breast cancer survivor, then having a mastectomy is just one piece of this entire cancer experience. And you know that. To really feel prepared and to make sure that you're doing everything you can to prevent a cancer recurrence, then you need to watch the next video I've linked up here, Tamoxifen Secrets. This is important stuff for you, Thriver, so let's get into it now. I'll see you in there.